You are listening to The Exam Room, brought to you by the Physicians Committee. Thank you, Dr. Barnard. My name is Chuck Carroll. I am the weight loss champion on the tweeters at Chuck Carroll, WLC. That's 2 R's and 2 L's. My guest apparently likes that. Dietitian Lee Crosby. She works upstairs at the Barnard Medical Center. How are you, Lee?
I'm doing well. How are you, Chuck?
I'm doing just fine. Have you tweeted today? You been on the tweeters?
I think I retweeted today.
Oh.
Maybe not.
No?
I was on Twitter.
There you go.
That has to count for something.
Absolutely, that counts. Get your follows up.
There you go.
Anyway, on a more serious note, this episode is called The Meat Cancer Connection. And Lee, the reason that I wanted to bring you back onto the show for this is because this is one that is very near and dear to your heart.
It is, yeah. So you want me to go ahead and...
By all means.
Yeah, so I do have I have a story here that goes with this. So in terms of what happened to me back in 2010, it was late 2010, I was actually having some pretty severe breast pain in my right breast. So I think like any woman would, I got pretty worried, went to my doctor, and she suggested, she did a manual exam, didn't find anything shady, but decided to go ahead and send me for a mammogram just out of an abundance of caution. I should put a caveat here that I was the ripe old age of 30 when this was happening. Mm-hmm. So I was pretty concerned. So the results came back, and what they found were some sort of suspicious spots. They were calcifications, and we decided to go ahead and biopsy them. And those, by the way, were actually in the left breast. So surprise! Yeah, not what I was expecting.
Right.
So they ended up being something called benign hyperplasia, which basically means not cancer, but your cells are growing more than they should. And it does mean you have an increased risk down the road.
It's still alarming.
Yeah. So I went ahead and got a breast surgeon because my family doctor was more than happy to pass the baton on that one, and got a full workup. And she actually found a thickened spot in the right breast that nothing had shown up on the mammogram, but it was about the size of a quarter. And so since I had just had a biopsy and I was not looking to get, another hole, no more cutting, I was over it. She offered the alternative of watching and waiting and checking every 3 months to see if anything had changed. So I thought, okay, I can do that, but I'm not just going to watch and wait because that's not who I am. I want to do anything I can because, again, I was only 30, anything I could do to reduce my risk. So I did some reading. I actually read the China study by Dr. Campbell, a couple of other books, things that I had kind of actually thought, particularly in terms of the China study, I had thought that was just, I don't know, maybe hot air. I'd never read it. When I actually sat down and read it and saw that it was based on, peer-reviewed, published research, I actually went to the National Institutes of Health, the National Library of Medicine, so I could pull the full studies and read the papers to see for myself if this was true, that there was a connection between animal protein and cancer, and lo and behold, there is.
Yeah.
So I went and transitioned onto a plant-based diet, and first 3 months went back for my checkup. Everything was the same. That spot was totally stable. Second 3 months, everything was the same. Third 3 months, everything was the same. And about that point in time, I had actually, it's a long story. I sort of fell off the wagon. Oh. I had taken Cipro a few months prior, which I probably actually shouldn't have even taken, but it had made my gut function a little bit special. And so it was sort of a misguided attempt to try and fix that. I reintroduced meat. I went on a really intense sort of elimination diet. But again, the mistake there was reintroducing meat while I did that.
Right.
Didn't know it was a mistake at the time. So I went for my final check with her thinking, this is going to be nothing. It's been stable for, 9 months straight. I should be graduated. Like, I'm done. But I hadn't anticipated that the diet change would make a difference. So I was actually 4 months, not 3 months, because I was running a little behind. And when I went back in for that final check, thinking I was just going to get a clean bill of health, that spot, which had been totally stable on a plant-based diet, totally stable, had doubled in size. So, again, in just 4 months, doubled in size. Terrifying. So I was back on the surgical table, within a week, I think. Super frightened. Had a lumpectomy, had a big old chunk of my flesh cut out. It was not a pleasant experience. And it was sent to the pathologist, and the results came back atypical. Now, I was really happy that it wasn't cancer, but I don't know if you know that much about atypia. Have you heard the term?
I know that somebody close to me had a little scarce, so I know a little bit. I'm certainly not an expert, but I know it's enough to yeah,
Yeah,
long nights.
yeah, exactly. It's not something you want to hear in reference to your own cells. So luckily with the lumpectomy, they'd gotten everything and it had clean margins, but the fact that I was sprouting atypical cells, again, I think I was 31 at this point, and the fact that just going from a plant-based diet back to sort of a meaty diet, and I hadn't been exercising as much, but the biggest change was bringing animal protein back in and animal fat, and to have it double in size and come back atypical, I was done. Because again, atypical is basically one step right before cancer. And the kind of atypia I had was one step right before they start treating you with tamoxifen and estrogen blockers. So I decided I was going to go right back to the plant-based diet, and I did, lower fat content, and I have been there happily ever since. And that was about 5 years ago, and so far so good. Knock on wood. I've had clean reports every year when I go back.
So speaking of going back, let's dial this back. It sounds to me like you did a lot of this research on your own. How much did your doctor try to school you on nutrition?
Not at all.
Not surprised, unfortunately.
Not at all. Yeah, and it's not that she isn't interested. That's just, she's a surgeon. That's what she does. And she certainly did say things like avoid alcohol, which is again a well-known risk factor, or minimize it, and to stay active. But that was really it, and eat a quote unquote healthy balanced diet. Well, what does that mean? In this case, I actually was eating a pretty healthy balanced diet. It just was fairly heavy on animal protein and animal fat.
Mm-hmm.
But I was still eating fruits and vegetables. I was doing that stuff. So for me, the real key here was meat.
So you've obviously, turned that corner. Have you had an opportunity to speak with the surgeon and kind of talk about going plant-based and the benefits that you found in that now?
Yeah, so I check in with her every year, and she knows that I'm plant-based, and she's delighted with the outcomes, and she, I'm sure, would be more than happy to have, more of that information in her practice. Yeah, she's been very receptive.
So early 30s, 30, 31. Was there a history of breast cancer in your family?
No history of breast
cancer
in my
family. So this just really out of left field just blindsided you.
Yeah. I mean, in hindsight, I figured I learned through the course of my research that I had some risk factors I didn't know that I had, one of which we'll talk about more, but was eating a lot of red meat during my preteen and teenage years. There are reasons, but it was no family history.
So you come through the other side, and I mean, you're sitting here, you're a dietitian now, so you must have had this epiphany, like, this is what I need to be doing with my life.
I did, and I turned to nutrition first because I had a background in nutrition, but I certainly hadn't, done the whole dietitian thing, and having had this experience was what made me go back to school, take those courses, go through the internship, and become a dietitian, knowing that this kind of nutrition was this powerful. This isn't something you get in a standard nutrition curriculum, so I'm really glad that I encountered it for myself. I could have done without the actual situation, but I'm really glad I found this information.
Absolutely. It's funny. I'm in school myself now, trying to get that.
Oh, bless your heart.
Fancy acronyms after my name.
Letters.
And one of the courses that I took this past semester was nutrition for athletes, essentially.
Wow,
and
nice.
They were just super big on meat and dairy, and I'm like reading this, and I'm like, why is this part of the curriculum? Like,
I don't know.
I don't understand why this is possibly part of the curriculum. They view it, the professor does, nutrition in a box.
Right.
They just regurgitate what they have been told. And so I wish I had the textbook with me. Like, you and I could go through it and be like, nope, and just cross it all out.
I did lots of that in my standard nutrition textbooks, and luckily I had some friends who were vegan and vegetarian, and they would listen to my little rants and things. I would literally text pictures out of the textbook where I had done strike-throughs and been like, inaccurate, exclamation point.
Right.
So yeah, it's pretty frustrating.
It is, and I don't know if this was a similar experience for you, like that little chapter on vegetarians and vegans. I mean, it was so short compared to everything. I remember in one particular chapter, we got a paragraph. Just
I have literally had a paragraph experience.
Yeah, and you're just like, and?
The heart disease chapter.
Oh, really?
Oh, yeah. They talk about all these things and interventions that can lower cholesterol by 5 whole points. And I'm sitting here like, clinically, it's better than nothing, but it's not really clinically going to make a difference to lower your cholesterol by 5 points. And then there was one paragraph that said a low-fat vegetarian or vegan diet may be helpful in reversing heart disease. I'm like, why is that one paragraph when we're spending pages on reducing cholesterol by 5 points?
Talk about burying the lead. I just
Big time.
dive into my news
Big
vernacular there. It's unreal to me.
So it really is.
You have this experience, you have this awakening, you go and you get this nutrition degree, and so this is just kind of your course in life now, huh?
It is. And, I sort of research the heck out of things if I'm nervous about something, like, having an increased risk of breast cancer. My way to deal with it is to be proactive and learn as much as I can. And so I've definitely done that on this topic and some of these sort of nutrition-related topics. Also, I just nerd out about nutrition.
That's a nerd out, man. That's what this podcast is all about.
Truth.
Your patients, do some of them come in? Maybe they've had some similar scares, and you've had the opportunity to talk to them a little bit?
Not as much, although I do mention it for women, again, because I think people just don't think about nutrition in terms of breast health.
Mm-hmm.
But even in terms of breast pain, keeping the animal products out of the diet and keeping the fat low, it really helps with breast pain. I know that, for instance, participants in our studies will, sometimes they'll say like, oh yeah, this is much better. Nice little side effect. It's not what we were going for, but it's not just future risk. It's also feeling better right now.